We all need human services. We're talking about childcare. We're talking about child welfare, physical and mental health. We're talking about immigration. We're talking about homelessness. We're talking about the spectrum of people's basic needs from womb to tomb. Without human services, we wouldn't be able to claim to be human. We wouldn't be able to claim to be the caring society we tell people we are.
My name is Sarah Muller. I'm a community health nurse with the Little Sisters of the Assumption Family Health Service. Since moving to New Jersey, it takes me 2 hours to get to work in East Harlem. I drive to the bus, take the bus to the city, take a subway, and then another bus to get to the office. Commuting that long every day is exhausting, but I do it because I love my job. I work with LSA, and our focus is to work with the most vulnerable families. We provide services such as a food pantry and advocacy office, early childhood services, parenting classes and groups, and a home health agency, of which I work as a visiting nurse. On Monday mornings, a lot of the morning is just spent catching up and checking in with patients. ¿Cómo está todo? Bien. ¿Y el bebé? The biggest barrier right now is poverty. Just dire poverty.
There are a lot of poor neighborhoods throughout the country and throughout the city. East Harlem houses some of the poorest families in New York City. East Harlem residents have an unduly high rate of illness and mortality.
On average, I visit about 15 patients or so a week. I especially love visiting the children and families that I get to know and develop a relationship with. It's Sarah. Hey, Kayvon, how are you? So tell me, since I've seen you last, you've started school. LSA uses a holistic approach when working with any of our families. So often when we come in with an agenda, something that we want to work with, the family is dealing with other issues that take more precedent, such as having food or housing. For example, when working with a family like Kayvon, who has asthma, I will go in to work on medications, but if he's breathing air that's unclean, my education only goes so far. So I'm working with our environmental program, who are going in, working with the triggers for asthma, which are cockroaches, the mold, the mice.
I'm telling you, I wish asthma on nobody.
Yeah.
Yep, person that don't have it, God bless them.
Both of them had been in the emergency room almost monthly, but until our services came in and deal with a holistic approach to the asthma, neither of them have been into the hospital. And so our home visits are much cheaper than an ER visit or hospitalization.
Okay.
Keep them out of the hospital. It's working so far, so yes. I'm really happy to hear that.
Yes, I really appreciate it.
Yeah.
And thank you so much.
Building trust is essential to making any progress for the family. Sometimes I feel like I'm able to gain a trust by the end of an hour visit. Other times it takes persistence and just the family knowing that I'm here for them. Well, baby Joseph and his parents, Kayla and Danny, were referred to us after Joseph was born with a cleft palate and micronathia, a very small jaw. He had surgery after being born to pull out his jaw, but we were asked to go in to support the family in the care for a child with multiple needs. And I won't need to come back anymore, but you have my number. Any questions you have, you know where to get a hold of me. I consider it a success when I've been working with a family, we have gained that mutual trust, and I can close the case knowing that the family is self-sufficient, is confident, and able to meet the needs on their own. I really feel that the work that I'm doing affects the families now, but also for many years to come, especially those families who are most vulnerable and most likely to fall through the cracks. But the reality is that I won't be here forever. And with the recession and the impact and the unknown, it's unclear whether my position can be replaced. And so that does give great concern on what will happen with these most vulnerable families and who will be there to make sure that they do not fall through the cracks.
why human service organizations are important. Picture a world without them. Picture no senior centers. Picture no Meals on Wheels. Picture no after-school programs. Picture no recreation programs. Picture no help for immigrants. Picture no HIV/AIDS clinics. Go one by one by one and picture none. And all those people, those 2.2 million we serve every day, they're still there with increased suffering and increased despair. But we're a caring society. That's why human service organizations are needed. This is the right thing to do.
Video provided by the Human Service Council of New York City, the folks down there helping us to understand a little bit more about what human service is all about. And that's what we're about, helping you to understand what human service is all about. We're going to try to see if we can contact the local branch of the Human Service Council here in Eastern Massachusetts and try to get them in here to BeLive, our BeLive Studios, CCTV, for a guest interview. Okay, I'm Hasson Rashid, and this is your Human Service News and Information. And once again, I welcome you to another edition with the cordial of peace. And it's excellent always being here with you, and it's such a great achievement to come into your lives once again. That was the Human Service Council Incorporated New York City branch, which I think their headquarters are located either here in Newton or New York City. But anyway, we're going to find out more about those people and try to get them right here at your Human Service News and Information. Okay, yes, I said it. It's excellent being here with you once again. Okay, first I'd like to give you a little rundown what's happening right here at CCTV. Starting tomorrow, August 1st, you can come in if you'd like to learn how to get involved with the community television, learn the different functions, aspects of what it is or what it's like to work in a TV station. Well, you can do so tomorrow. You can get a good orientation, a free orientation. That's tomorrow. Here, you can learn to produce your own TV shows, take hands-on classes in camera, editing, sound, and lighting, documentary production, and so much more. Host your own live program. Become a citizen journalist. Learn how to use a computer. No experience needed. All you got to do is be here at 6:30 tomorrow, and you can get yourself situated into learning the things that you can do, such as produce your own TV show here at CCTV. We're at 438 Massachusetts Avenue, right in the heart of Central Square. That's Cambridge, Mass. August 1st, 6:30 p.m. Free orientation to come in and learn how to produce your own TV shows, etc., etc. So you just gotta come in and see for yourself. I can just go on all day, but it's nothing like you coming and pairing in person and learning what it's all about to be a member of the CCTV community. Okay, become a member of CCTV community. Okay, there's also a screening free and open to the public. Summer Media Institute is a 6-week media art and work experience program with challenges teens to create honest stories about themselves and the communities while teaching them media literacy and productions. That's screening. That's free and open to the public. That's the Cambridge Public Library, 449 Broadway, and that's Thursday. That's Thursday, August 8th, 6 to 8 p.m. So you should get on out there if you're interested in that aspect of broadcasting, TV broadcasting. Okay, Saturday, August 24th, 2013, time 8 a.m. Lincoln Memorial, Washington, D.C. That's National Action Network and the Martin Luther King II. They're going to have their 50th March, anniversary of the 50th March on Washington. That's the National Action to Realize the Dream. Let's see, 50 years ago, Martin Luther King headed and conducted the March on Washington. So they're going to celebrate the anniversary, 50th anniversary. So if you're interested in joining, you can contact, or interested in a Cambridge to D.C., Washington, D.C. round trip ticket down there for this event. You can email Priscilla at 337@yahoo.com. That's Priscilla 337@yahoo.com. So expect to hear more about this one in the weeks to come here at CCTV. So it's plenty of time. That's maybe a week or 2 weeks away. So that's the 50th March. Anniversary of 50th March on Washington, D.C., and it's co-sponsored by the National Action Network and the Martin Luther King Martin Luther King III, okay? And that's a round-trip ticket to Cambridge to D.C. for this event. And once again, if you're interested, you can contact Priscilla 337@yahoo.com. Once again, that's Priscilla 337@yahoo.com. And also coming up in the weeks and months to come, September 25th to be exact, there is the CCTV Backlot Barbecue. And the name has been changed from the CCTV Backyard Barbecue to the Backlot Barbecue because of the relocation of CCTV from Prospect Street to our current location here at CCTV. Okay, I'm Hasson Rashid, and it's always excellent being here with you, and I love you as much as I love myself, okay? And so, this is your this is your Human Service News and Information, okay? Getting on with the Human Service News, some of the headlines from the Human Service News. Sometimes the news is good, sometimes it's bad. But this one, I don't know. I don't know how receptive you are to this one, so I don't know. But I'm going to just try to give you a few lines of this. Okay. Thursday, a couple Thursdays ago, in the wake of the failure of the Farm Bill on the House floor 3 weeks ago, the House passed by a 216 to 208 a new version of the Farm Bill that includes only the agricultural provision of the early versions, the Supplemental Nutrition Income Program. That's SNAP. That's the former food stamp was named the former food stamp. So the Supplemental Nutrition Assistance Program, SNAP portion, formerly the Title IV, will reportedly be taken up at a later date. The new farm-only bill, H.R. 2642, was passed after hours of partisan debate over the wisdom and consequence of separating the two proportions. The Farm Bill has included farm support and nutrition provisions for many decades, since this arrangement allows both urban and rural interests to come together and ensure passage of a combined measure that benefits a broad range of constituents. House Democrats charge that the separation tactic is intended to pave the way for future SNAP cuts. Okay, in the Thursday vote, all Democrats voted against the revised bill, as well as 12 Republicans. So expect to hear more about how the SNAP bill is separated from the Farms bill. The SNAP program is separated from the Farms program in the weeks to come here at BeLive, CC TV, your Human Service News and Information. 34 billion budget approved on Beacon Hill. The University of Massachusetts students will face no tuition or fee increases for the next 2 years as a result of higher education funding included in the $34 billion state budget sent to the governors several Mondays ago. That relies on $500 million in new taxes. The compromise budget proposed would authorize a 4% increase in spending over fiscal year 2013. It was approved by the House and Senate in separate votes and sent to the governor for a 10-day veto period. Okay, the Caring Force, which is a wing of the Massachusetts Council of Human Service Providers, want to thank you thank your hard work during the months of the budget advocacy. 19,000 low-paid human service workers have the chance for a modest pay increase. More than 80 people have already signed the card showing Governor Patrick that we appreciate his support for human service workers. Okay, so I think that that part of the budget was passed. We're going to get on to that. Okay, here it is. Governor Patrick just signed the budget, and thanks to your advocacy, we preserve the salary reserve. This shows us once again that when we speak out together, we can make big things happen. We set a goal of sending Governor Patrick's 2,500 emails in, and you stepped up and sent nearly 2,000 and 26,000. So thank you so much, everyone who took action. And what they want you to do is to email the governor and email all of your elected officials and tell them that you thank them for pushing this legislation forward, and you thank the governor for enacting this legislation into law. That's a salary reserve. It's an act that will allow low-paid human service workers to be financed. Okay, to be financed. Okay, so you're going to hear more about that in the weeks to come here too. Okay, another thing, there's Amendment 28. That's the London Amendment, and it's the immigration law which puts the jeopardy. It's a law which puts housing for immigrants in jeopardy. So if you're an immigrant from Haiti or wherever you're from, your housing is in jeopardy. So what you should do is contact your legislators and tell them to get behind the ball, get on the bandwagon, and do what you have to do about this Amendment 28. Okay, I think they're gonna act on it this week, so you got plenty of time. Okay. 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 We're gonna skip that one and move right along here. Okay. The Interior Appropriations Subcommittee sent a bill for fiscal year 2014 funding to the full Appropriations Committee that includes only $75 million for the National Endowment for the Humanities, a drastic 49% cut for the agency. This bill threatens the viability of 56 states and territorial humanities councils, which you see significant funding from the National Endowment for the Humanities. Before the full Appropriation Committee voted on the bill, I urge you to contact committee members and voice your opposition to cuts that would have the NEH devastate the State Humanities Council and force the elimination of programs that thousands of communities across the nation need, which is NEH, is an acronym for the National Endowment for Humanities, supports the State Humanities Councils primarily through the Federal State Partnership, FSP, which is currently funded at $38 million, a significant cut from the $47 million the councils received in fiscal year 2010. Through the FSP and We the People funding, the subcommittee severe cuts would compromise the council's ability to deliver programs to communities throughout the states and support their more than 10,000 local partnerships. The councils are non-profit organizations delivering programs in rural areas and inner cities, often to groups that would otherwise not have access to such resources. Although councils raise funds from corporations funding state governments, and individual federal funding is key to attracting these other kinds of support. So you're urged to contact your colleagues on the Full Appropriation Committee today and encourage them to oppose the steps to cut NEH and preserve the State Council's valuable programs and services in our communities by rejecting the subcommittee's bill. Okay, before we get on, I'd like to thank Bika. She is our new temporary cablecaster, and without her we wouldn't be able to get our broadcast out to you. So once again, thank you, Bika. And I saw Chloe here too. She's here, and she is, I think, one of our permanent volunteer intern cable catcher. So I also thank her too. Okay. Okay, I'm gonna move right on here to something else I have for you, if time permits. Okay, this is what I know you're interested in. The feds give Massachusetts power to police retail food stamp fund fraud. Okay, that's fraud. The Fed gives Massachusetts power to police retail food stamp fraud. State and federal officials today signed an agreement, that was yesterday, empowering Massachusetts authorities to investigate retailers who may be engaging in food stamp related fraud, because the Supplemental Nutrition Program, SNAP, is a federal one. National authorities usually investigate retailer fraud while leaving consumers' fraud investigated up to the states. But under the agreement signed today, state agencies can now go after stores that accept food stamps in exchange for lesser amounts of cash, pocketing the difference. Department of Transportation Assistant Commissioner Stacy Monahan called it a first of its kind agreement in Mass, and said it will allow the department to collaboratively investigate potential SNAP trafficking and allow law enforcement to prosecute those who are making money by defrauding the system. Massachusetts has become the 15th state to have an active agreement of this type with the Department of Agriculture. Okay, so Massachusetts isn't the only state that's making this a law to have a photo attached to your EBT card. So a lot of other states are trying to do something about this food stamp fraud, this EBT fraud, but I think Massachusetts is the only state that's gonna make it mandatory for a photo to be added to the EBT card. So there's a lot of opinions on that, for and against that one. Okay. Okay, 3 states expand Medicaid prevention services under Obamacare. 3 states have taken a deal offered by the federal government under the Affordable Care Act to expand their Medicaid coverage of preventive services. Nevada, New Hampshire, New York have had Medicaid state plans amendments approved by the Centers for Medicare and Medicaid Services, CMS, to cover more preventive services. According to CMS, California and New Jersey have filed amendments, but they are still under review. Under the health reform law, if states agree to cover all services graded A or B, in other words, highly recommended by the U.S. Preventive Service Task Force, an independent panel that makes public health recommendations, they will receive a 1% increase in the matching rate that CMS contributes to their Medicaid program to pay for those services. Okay, so expect to hear more about that issue as it develops. Expect to hear more pro and cons and what the average citizen out there in our community thinks about that. Okay, immigrant rights advocates protest the housing. That's the one I was just telling you about. How this Amendment 28 has gone to the legislature for approval, and this was an amendment sponsored by a Weymouth Republican, and his name was Representative Ludland. Okay, so the thing is, this puts jeopardy a lot of the housing. Domestic housing arrangements of immigrants. So if you have a sensitivity to this one, I advise you to still contact your elected officials about it. Okay, here it is. The salary reserve included in the budget that you signed could prove a much needed raise to thousands of low-paid human service workers. 1 in 10 Massachusetts residents receive support and empowerment from human service workers. This fund could help ensure they continue to receive consistent quality care. On behalf of the caring for thousands of workers and hundreds of thousands of clients, consumers, they thank you for supporting human service workers and the people they serve. Okay, and you should also thank the governor for putting that into effect. Okay, I'm Hasson Rashid, and there's one more thing I'd like to remind you of today. At 23 Sydney Street, there is the C2W Farmers Markets. They're open with all types of produce, freshly arrived from the farms. That's vegetables and fruits and other good things over there. So that's farmers markets. 23 Sydney Street. They're open right there, right now, today, until 6 p.m. Okay? Another thing, Monday, right here at Central Square, you can go right over to Bishop Allen Drive, Norfolk Street, noon to 6 p.m., and there's a Central Square Farmers Market, and there's also all kinds of fresh produce for all you out there who love to cook, experiment in the kitchen with fresh produce. It's nothing like getting it when it's straight from the farm. Okay, I'm Hasson Rashid, and this has been your Human Service News and Information. And I'd like to remind you that next week it's, I guess, the final broadcast where we'll be touching on Ramadan. So until then, I'd like to remind you that you should keep your nose clean, play it straight, don't play to lose, and play for success. Play it straight. Play it straight for success. And until I see you again, I'd like to leave you with the cordial of peace, and that is peace. Peace be unto you.
We all need human services. We're talking about child care. We're talking about child welfare, physical and mental health. We're talking about immigration. We're talking about homelessness. We're talking about the spectrum of people's basic needs from noon to 2. Without human